How much do you know about Dr. Michael Debakey? I know we've all heard about Debakey forceps or Debakey vascular clamps, but what else do you know about him? He was born in Lake Charles, Louisiana on September 7th, 1908. So if he were still alive today, he would have just recently celebrated his 117th birthday. He was the son of Lebanese immigrants, and he grew up watching his mother sew very intricate, detailed patterns by hand. And watching her sew with that precision and craftsmanship actually influenced him later in life, although obviously instead of fabric, he was working with human tissue and with blood vessels. It was obvious from the time he was in medical school that he was on the path to becoming a giant in the world of cardiovascular surgery. As a medical student, he built a pump that could deliver blood from a donor to a patient. And this roller pump eventually became a key component in the heart-lung machine, which also paved the way for open heart surgery. But he didn't just pioneer new techniques, he also reshaped the tools that surgeons were using. Debakey forceps have a very fine, atraumatic, ribbed tip, and they are specially designed to handle delicate tissue like blood vessels without causing damage. And you see them used in almost every vascular surgery. He also created Debakey vascular clamps and Debakey scissors, and these are tools that allowed surgeons to perform intricate vascular procedures with greater control and safety. Perhaps one of his most famous milestones came in 1964. At Houston's Methodist Hospital in Houston, Texas, Debakey performed the world's first successful coronary artery bypass, and thus opened the door for countless lives to be extended because of modern heart surgery. But he didn't stop there. He also developed groundbreaking techniques for repairing aortic aneurysms. Outside of the OR, Debakey served as a medical advisor for the U.S. Army during World War II, and he helped create mobile Army surgical hospitals, or MASH units. These units revolutionized battlefield medicine, and they brought surgical care closer to the front lines and dramatically reduced wartime death. Interestingly enough, Debakey had the unique experience of being saved by a procedure that he had devised. In late 2005, he suffered a dissecting aortic aneurysm, and after initially refusing surgery, he was operated on, becoming the oldest survivor of his own operation at 98 years old. And in his procedure, they used a graft like the one that he had pioneered. Dr. Debakey's career spanned over 70 years. He died in Houston, Texas on July 11, 2008 at 99 years old. He had performed more than 60,000 surgeries, trained generations of surgeons, and he left behind a legacy of innovation that lives on in every operating room.